Hey, Dr. Steve Bjorn here with Core Rehab. I was going to give you a little general information about trigger point dry needling. So trigger point dry needling is probably the most powerful tool that is available to physical therapists. I've seen better results with it than people have had with manipulation, massage, even injections, surgeries. We've had people get pain relief after 10 years of chronic problems with the trigger point needling. It's a very powerful tool, and actually started from physicians doing trigger point injections. So they were finding trigger points that were causing people pain, and they were putting medicine into those trigger points, both pain numbing medication and anti-inflammatory medication. And they were getting great results, so they were studying it, and they found that what they expected was when they put the medication in there would be an electrical change in the muscle. And what they actually found was as soon as the needle got into the trigger point, the electrical activity in the muscle dropped, and it kind of normalized the way the muscle is functioning. So it resets your muscle, helps it to start working better, and helps it to improve the function. And then you have a decrease in the muscle spasming and the tension and in the referral patterns. Trigger points can refer pain all over the place. Trigger point in your hip could refer pain all the way down to your knee. Trigger points in your upper trap could refer into headaches. Rotator cuff can refer all the way down your arm. So you can get pain all over the place from trigger points that could be in an area that you don't even know is a problem. Had several people that have had headaches, and we do a trigger point dry needling to their upper trap and their headaches go away, or pain down in their arm, do some trigger point dry needling to the rotator cuff and their arm pain goes away. So we're going to do a quick demonstration of trigger point dry needling for the upper trap, and then we'll have several other videos of other areas that we'll needle as well. So here we're going to find a good trigger point in her upper trap right here. So we're going to find a spot that is very tender and tight, like right there. And then we're going to get a hold of that, lift that up away from the rib cage and long field. We're going to do a little insertion of a small needle here. We're looking for a little muscle response, where the muscle kind of gives us a little grab or a little twitch, and there it is. So when we find that little twitch there, that's a good thing. We want that because that's going to help reset that muscle and make it work better. And then we'll frequently use a little electrical stimulation, and this is much more powerful. We're going to turn it up until we see a good little twitch here. We want to get that muscle to contract a little bit. Here you go. We got that little twitch going there. There's like a little heartbeat in our muscle. That's going to reset it and help it work a whole lot better. So we frequently use the electrical stimulation to help these muscles even more than just the needling does by itself. And this is 100% different than just the TENS units or the muscle stim units that have the patches that you put on the skin, because this is actually stimulating inside the trigger point, inside the muscle, and that is about 100 times more effective and more powerful than the TENS units or the muscle stim units are. And we don't have to do it for a terribly long time. Sometimes we'll do it a little bit longer when it's a little bit more chronic, but we just get that in there and then we're all done, and that muscle is much more soft and pliable. The side effects are sometimes you do get a little bit of soreness. You can have the muscle feel like you had a hard workout, like you lifted heavy weights, but the pain, the range of motion, the function of the muscle, your overall pain, headaches in this particular scenario get significantly better because that muscle is now not holding constant tension in it all the time. It's working more the way it's supposed to be.
Please like and subscribe to our YouTube channel.